Hello, so this video is Asian American mental health, practice tips for working with patients and their families.
Let's talk about clinical presentation once we do have someone come in for any sort of illness at all in medical illness. First of all, for some of the Asian languages, it's actually very difficult to say yes or no. There might not be a single word that says yes or no. So you might say, do you have or not have this? And then a Chinese person would say, 我有 or 我不有, have, not have. But it's not yes or no. There's this wonderful movie called Chan is Missing, where the cab driver is stopped by the police officer, who's not Chinese, and says, did you see that stop sign? And Chan says, well, you know, I'm working to put all my children through college. And the police officer gets frustrated and said, did you see that stop sign that you just ran? And then he starts talking about how many hours he works and so forth. And Chan is using metaphor. It's not a yes or no question for him. It's like, I'm a good person, therefore, how could you possibly think that I would run the stop sign and please don't ticket me because I'm working to put all my children through college. But the Western, Caucasian American police officer doesn't understand and, I think ends up taking him in. So the use of metaphor instead of yes or no. Contradicting. It's actually very bad manners to say, no, it's not like that. Or if somebody says, did you have a good vacation? It's like, nah, it didn't work out right. It's considered sort of rude. So in a medical setting where you're saying, are there side effects, this and that, it's often very difficult for a patient to say, I'm having a side effect, or I don't like this medication you prescribed for me. And actually in Chinese, the word any questions, you ask after you've talked about this, is the same as any problems. So you say, 有没有问题? And that basically means, do you have a problem with what I just said, rather than any questions. Nonverbal expression. How many of you have written or were taught on your mental status exam to say eye contact, good, fair, poor, right? But in many Asian cultures, you're not supposed to make eye contact with someone who is of the other gender or you're superior in some way, by age, by authority, and so forth. And so they might actually lower their eyes in deferential thing. It might be a sign of respect, whereas you might interpret that as being a sign of disrespect. And then tongue clicks. This is one of my favorite examples in terms of medical illness. When I was a medical student at San Francisco General, a Caucasian OB resident told me, very sure of himself, that Chinese women felt less pain, which was news to me. And sure enough, he was giving less pain medication or no pain medication to women with tears, episiotomies, and so forth. But as I witnessed with the very next Chinese woman who went into labor, she went, and he said, what's this tongue clicking they always do? And I said, that's pain. But he didn't realize that. And I thought about it. For the most part, cross-cultural things are not taught in medical school, clearly not to this particular resident. But I think in general, there's no way to know these things if you don't find them out somehow. And it wasn't his fault he didn't know this, but it turned out he was probably treating a lot of Chinese moms with substandard care. Gestures. What are some examples? This, which can mean A-OK in American culture, is a rude gesture in some Asian countries. It's sexual. I won't go into detail. The crossed fingers, like this, like good luck, I hope you get it, is also sexual in some countries. Showing the soles of your feet in any way. So, for example, leaning back and having your feet up on a footrest where somebody else can see it, that can be considered rude. And then some of the things that are rude here that aren't rude in other countries, burping in China is not that rude. You can be in mixed company, you can be with friends, family, business partners after a good dinner in China and burp. It's like, that was a good dinner. Considered sort of rude here, am I right? And then blowing your nose in Japan. I think you're allowed to sort of dab gently with a handkerchief, but actually like that sort of honking nose blowing that we accept here is considered actually quite rude. And then respect for authority is, I talked about that. And then the negative family history, how am I doing on time? I'll talk about it now so that I don't run, because this is possibly one of the most useful things that you can take back to your own practice. 99.9% of the time when you ask an Asian family patient if there's a family history of a mental illness, they will say no. And they will say no before you finish your sentence. And there's been some research for this. So, for example, Kiki Chang at Stanford and Terry Ketter are bipolar experts, and they found that the rate of bipolar in Asians versus not was the same, but the family history was completely different. So either Asians were all getting mutations suddenly, this generation, that's a joke, it's not actually physically possible, or there was a positive family history that they wouldn't talk about. So I tell all of my medical students and residents that when you're doing the Asian family history, have as many people in the room as possible, and put down your notepad, put down your computer, watch them all like hawks. And then you start asking, so you'll say, does anyone have a history of schizophrenia? They say no, before you finish the sentence. So you say, does anyone live with a family member, adult family member who didn't get married, doesn't have a job, and is living with somebody else and dependent on them? And then you look for the look. This is so gratifying. I had this happen recently. And the medical students, it just happened just like you said. As soon as I said that, the youngest person in the family, who's often the first one to crack, by the way, looked, and I said, what was that look? And then the mom, before he could answer, began shouting, he's fine, he's fine. I said, who's fine? What? I said, well, Uncle just sits in Auntie's house all day and talks to himself. And I was like, maybe that's schizophrenia. So that's a good high-yield question for both schizophrenia and bipolar. For bipolar, ask about gambling, maybe drinking. A lot of us has the Asian flushing reaction, so we might not be able to drink that much. But someone who's done sort of irresponsible things, couldn't take over the family business, so forth. For depression, when you can talk about some of the behaviors, and I ask about accidental deaths or unexplained deaths. And here's where one of the examples was, so in rural China, it's often pesticide ingestion. In India, particularly among women, it's cooking accidents. In Japan, it's drownings, or in urban Japan, subway accidents. And I was asking a family about suicide risk, and they all said no. And I said, any unexplained deaths? And they said no. I said, any mysterious accidents? And then they looked at each other, and I said, what was that? And then they said, well, Grandma fell in the well. And I remember thinking, I didn't say this out loud, but I was thinking, the well doesn't move around at night, right? It's not as though Grandma went out to feed the chickens, like, oh my goodness, I forgot the well was there. But I asked, what happened right before it happened? They said, well, Grandpa got a concubine. So, but they were very adamant that it wasn't a suicide. So that's probably one of my top take-home tips. So Asian Americans are 25% as likely to seek mental health treatment. They have a stronger sense of stigma. They're more likely to drop out, even if they do start. And they are covertly non-compliant. When I've gone to audiences that are mostly non-Asian, and I ask, do you think Asians are more compliant or less compliant? And they almost always say more compliant, because we kind of look compliant, right? But this was a wonderful study from Kinsey, not the sex study Kinsey, but different spelling, where they weren't even doing a compliance study. They checked TCA levels just routinely in this refugee clinic that was 100% Asian, and they found that 61% of the patients who they thought were on TCAs had no detectable level of antidepressant in their bloodstream. And another 24% on top of that had very low levels, for a whopping total of 85% with low or no levels. And then when they asked afterwards, using sort of face-saving questioning, the patients did admit that they weren't taking the medication for various reasons, and I'll talk with you about face-saving ways out. I'll talk with you about what we're doing at Stanford, and then I don't have data for whether they're more likely to receive IM depot medications, but I've seen this in my own clinic, and I also talked with representatives when Risperidone Consta first came out. It was the first atypical IM depot medication, and it wasn't being taken up that much in most of the states, but of all the 50 states, Hawaii was using it like gangbusters. And I asked the reps, what do you think that's from? They said, we don't know. I said, do you know what the ethnicity is? No, we haven't been keeping track of that. And I said, well, you know, Hawaii of all the 50 states has the most Asians, you know, and but I don't know if they were able to see that. Oh, and then I should mention that the ones in my clinic, you know, when I ask, you know, the non-Asian families, sort of like, you know, we have a medication that your son always does better on medication, but he always stops. And then the non-Asian family is sort of like, you know, do you want to? And the kid says, no. It's like, he doesn't like needles. And that's the end of it for the non-Asian family. For the Asian family, the young person says, I don't like needles. And then the dad says, if you do not take this medication, you are not my son. You are not getting in the car. We're not going home. It's like, okay, here we are. So for better or worse, the Asian family is not a democracy. So wider cultural implications, we do know, and this is some research by Andres Pumariega, by 2050 there will be no majority population in the United States. There's some of the things I've already talked about in terms of acculturative family distancing, that's one term for it, and that minorities are less likely to get mental health services according to the Surgeon General's report. So 1 in 3 of people in general get the mental health services they need, but 1 in 10 of minorities. Things that I haven't had time to talk about today, because this is a whole other topic, are the biological factors. Some of this is P450 interactions. I alluded to the fact that I and many Asians can't metabolize alcohol well. And then there's what is sometimes called the Tortilla Factor. Different diet can affect how different medications affect a patient. And then herbs. There's often people taking herbal medications that you don't know about that can have major effects on how they're doing. So here's some definitions of cultural competency. I'm running out of time. So practical recommendations. Understand what your assumptions are. Assumptions aren't bad. We couldn't go through life without assumptions, but know what they are. And know when there's a difference between your assumptions and your patient's assumptions. Learn about your patients. Keep talking with them about their backgrounds. Work with the family, not against them. They have way more energy than you do, so you don't want to fight them. Use translators wisely. And provide face-saving ways to work with conflicts. So, for example, when you say, you know, if you're just sort of like, did you take that medication I prescribed you? They're going to say yes. But if you're sort of like, you know, sometimes when people go to the pharmacy, they find out that the copay is higher than they realized, and they decide to save the prescription for another time. Did you think about that? Yeah, I thought about that. Did you do that? Yeah, I guess I did. Or sometimes when patients take the first dose of medication, they get a side effect that they don't like, and they decide to save the rest of the bottle for later. Did you think about that? Yeah. Did you do that? Yeah. So that provides face-saving without them having to go directly against you. So other specific practical tips, when you have a meeting, sit at the head of the table, which is the seat that's the farthest away from the door. I learned when we hosted Japanese psychiatrists from Japan that, you know, that they always address the person at the head of the table, whether that was the medical director or the second-year resident. So now I just do that routinely for all family meetings. It's almost sort of a subliminal thing. There are many numbers that are either auspicious or inauspicious. So the number 4 is an unlucky number in China. It sounds like the word for death. The number 8 is a lucky number, and red is a good color, white is the color of death, bats are good luck. There's all sorts of things like that. And then we talked about what's rude and what's not, and we talked about family history.
Okay, so that's it for this video. Thank you for listening. I certainly got some good information from that I didn't necessarily know. I hope you did as well.